Carpentier in 1983 described a classification mainly for mitral regurgitation from the point of view of surgical repair. It considered the etiology, pathology, and pathophysiology of mitral valve dysfunction. Initial classification had classes 1 to 3 with subclasses, while class 4 and 5 were added later. In type 1, motion of leaflet margin is normal, while there is prolapse or flail leaflet in type 2. In type 3A, there is restricted leaflet opening, while type 3B has restricted leaflet closure. Type 4A has systolic anterior motion, and type 5 has features of more than one of the other types. Type 1 occurs in valve leaflet perforation associated with infective endocarditis. Type 2 is the pattern seen in mitral valve prolapse. Restrictive opening in type 3A is the hallmark of rheumatic mitral valve disease and is due to commissural fusion. Type 3B with defective leaflet closure can be secondary to myocardial infarction or dilated cardiomyopathy. Systolic anterior motion in type 4A is characteristic of hypertrophic cardiomyopathy. Combination of rheumatic valvular disease with a perforation induced by infective endocarditis is a typical hybrid condition qualifying for type 5. Here are a couple of relevant journal references. Thank you for watching this video. Please subscribe, like, share, and post your valuable comment below this video. Kindly press the bell icon after that for getting all updates.